I presented on the topic of precision medicine and the need to think big. We hear this is actually, in one sense, the center of where the Human Genome Project is actually still being kept alive. Today, we need to also think big, replicate that in one sense, in its bigness and its largeness, but at the same time assess the phenome and the genome at the same time. Let's look at sequencing technology. Here, BGI. BGI is responsible for some of the very best, I would argue the very best technology to conduct sequencing. But the phenome needs to also have the very best technology. And you need to combine the two. We need to do the same level of measurement, sophistication and impact as sequencing has in terms of the phenome. There are big threats facing humankind. Our design 150,000 years ago and now has changed very, very slightly. Our environment has dramatically changed. So we're living in a world that's mismatched. It's not matched with our design. We can't change our design with any drug. We have to change the environment, and we need to know who are those who are going to be more predisposed to falling ill in that environment, in the environment we're creating. And let's get precision medicine to work. And the reason why this is very important is the health services around the world are not able to cope with the amount of people who are getting ill. So we even need to get to them before they get ill, using the same technologies to look at what I call precision prevention. Not everyone will be prevented from disease using the same program. We have to individualize it. And when they do get sick, we have to individualize the treatment. For me, BGI has been incredibly supportive. Coming back here to BGI allows me to also find out what the new developments are, to go into the labs and see what is coming. Because I want that as well in my laboratories, because I want to use the very best technology and be up to speed with what is happening. And at the same time, in the other direction, inform BGI what technologies they need. And already I can tell you that my insistence that BGI develop the same level in terms of impactful technology, in terms of genomics, sequencing technology, they do the same in phenomics, assessing the environment, assessing the individual, non-genomic parameters. So we have to speed up. And what COVID and the pandemic taught us, if we work together, science beyond barriers and borders, we can do anything.